It is a great pleasure for me to join you today for the second 32 PMSCH board meeting. I am pleased to know that we continue to build on a long tradition of our commitment to women, children, and adolescents, and our close collaboration with PMNCH. I commend PMNCH for its steadfast commitment to the well-being of women, children, and adolescents. And as always, the Government of India remains committed to advancing the well-being of this population group. The Government of India, which has the largest program in the world for the health and well-being of adolescents, is a proud partner and was pleased to organize the very successful co-branded G20 event and host the board in June 2023. We look forward to the next steps emerging from the forum and the campaign, especially how we can work collectively to mobilize greater commitments and work towards further highlighting for adolescent well-being at the summit of the future. As a nation that has invested in the well-being of this population group, we understand and advocate for increased investment in their well-being. This agenda is critical for achieving the Sustainable Development Goal 2030 and nations stand to reap multiple benefits from investing in this population group. To ensure these groups receive the attention and prioritization they deserve, we are following a holistic and inclusive approach aligned with the vision of universal health coverage and India's commitment to leave no one behind. The government, under the unparalleled and visionary leadership of our Prime Minister Narendra Modi, is making relentless efforts to improve healthcare system and services towards providing better quality and affordable care to people in line with vision well unenunciated priorities for Antyodaya, reaching out to the who need is the most towards shaping a holistically productive and developed nation. Women, children, and adolescents are rightly perceived to be the future of a country, and the same focus has been adopted as a guiding principle, and programs are designed accordingly. Therefore, initiatives like Ayushman Bharat Health and Wellness Center, India is committed to achieving promotive, preventive, curative, palliatives, and rehabilitative aspects of universal health coverage, with a goal to provide comprehensive primary health care, including both maternal and child health services and non-communicable disease, as well as free essential drugs and diagnostic services through Ayushman Bharat Health and Wellness Centers, closer to the home of people. More than 162,000 Ayushman Bharat Health and Wellness Center are providing comprehensive primary health care across the state and union territories. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana is a game changer in the healthcare arena with the vision of creating an Ayushman Bharat where every citizen is not only healthy but also free from the burden of healthcare expenditure. As we proceed with the discussion, I encourage our partners to discuss best practices and ensure that we learn from one another, finding way to improve policies, increase investment, and ensure access to quality services for women, children, and adolescents. PMNCH has a critical role to play in this as well as in advancing the drivers of development and with its partners setting the post 2030 development agenda. In conclusion, I reaffirm the Government of India's commitment to the health and well-being of women, children, and adolescents. I look forward to rich discussions on how PMNCH can mobilize and facilitate all the work by its partners and how we can leverage each other's strengths to build a healthier, brighter, and more sustainable future. Thank you. Thank you very much.
Thank you very much, Minister, for your very encouraging words. As you said, India has the largest programs in the world covering women, children, and adolescents. And of course, this means that when India moves, it moves global progress and global averages. And certainly India is making its mark in these areas.